بسم الله والصلاة والسلام على سيدنا محمد وعلى آله الطيبين الطاهرين وأصحابه المختارين. Assalamu alaikum wa rahmatullahi wa barakatuh. In this lecture, we are talking about hypothermia and the coagulation in postpartum hemorrhage. We know that hypothermia is part of the lethal triad: hypothermia, acidosis, and coagulation. Even mild hypothermia less than 35 degrees centigrade worsening the bleeding in postpartum hemorrhage. Affect the clotting factor and platelets and fibrinogen. Let us go and explore the story of hypothermia and how it's affected our patient. First, the hypothermia is going to slow the coagulation cascade. Coagulation enzyme functioning best at 37 degrees. As the body temperature falls, the enzyme reaction slow markedly, and this is delay the thrombin generation and fibrin clotting formation, resulting in prolonged bleeding, which lead to delay clotting and prolonged bleeding. The cases of platelets dysfunction. Platelets count may remain normal, but the platelets function is impaired by 1/3 in cases of hypothermia. Reduce the platelets activation, platelets adhesion, and platelets aggregation. It will be normal at 37, will be and hypothermia, it will be weak platelets blood. Reduce the clot's strength. Fibrin polymerized become less efficient, and the formed clot is weaker and more susceptible to disruption and fibrinolysis. Normally, strong fibrin clots develop, where in hypothermia, weak fibrin clots are easily disrupted and broken down. Worsening acidosis and shock. Ongoing bleeding cause poor tissue perfusion, reduced perfusion leading to lactic acidosis. Acidosis further inhibit coagulation factor activation and creating vicious cycle. Hypoperfusion plus acidosis worsening the coagulation. It's affecting on the coagulation, reduce the enzyme activity, reduce the thrombin generation, reduce the fibrin formation, and reduce the platelets function. It's increased transfusion requirement. Patients with hypothermia bleed more, require more blood product, and have higher rate of massive transfusion and experience increased maternal morbidity and mortality. The high risk of massive transfusion, organ dysfunction, and maternal morbidity and mortality increase. Hypothermia developed during massive blood transfusion protocol. Why? Because rapid infusion of cold crystalloid, large volume of cold IV fluids lower the core body temperature. That's why you have to be sure that you have a warmer in the labor room. Actually, there should be a warmer in the labor room, and this warmer should keep the temperature of the fluids 37 degrees, and be sure that you are hanging for patients fluids which is warm. A lot of time the warmer is there, people they don't recognize, nurses forget to put the fluids. It's not the standard, so implemented this is as part of the protocol of labor room. Transfusion of unwarmed blood product. Cold blood product reduce the core temperature. Also, there is a warmer for fluids, and it should be there in every labor room. If it's not there, be sure that you fight your right to have a blood warmer in the labor room and in the operation theater. Large blood loss. Loss of the warm blood, reducing the body heat contents and impairing the thermoregulations. Exposures in the operation room or the delivery room. Exposure of the body to the cool environment increase the heat loss. Remember that if you don't have warmer, to have warm blanket covering the area which you don't need to expose. Prolonged surgery, long duration, increased heat loss through the radiation and convection and evaporation. General anesthesia, anesthesia impairing the body thermoregulations and causing peripheral vasodilatation and increase the heat loss. These factors lead to drop in the core temperature, which worsening the coagulopathy and increase the bleeding in postpartum hemorrhage. Can we prevent and manage hypothermia? Prevention can be by maintaining the core temperature around 36, by maintaining normothermia through the resuscitation, used warm IV fluid and blood product, use forced air warming blanket. If it's not available in your organization, you can use warm blanket to cover the patients, increase ambient room temperature when feasible, and it should be between 24 26. I know it's very crucial to work in a hot room, so better to use a forced air warming blanket. A lot of time it's available, but the anesthesia, they are not giving it. They think they will put it in the recovery, insisting that while you are resuscitating your patients to have it, go back to your labor room and be sure that you have one in labor room. Minimizing the patient exposure and cover non-operating blood surface, cover the patient with warm blankets, and continuously monitoring the core temperature during massive transfusion. And if it is less than 36, you have to use warmer and warn the anesthesiologist to use warm fluids. Preventing hypothermia, protecting coagulation, and save life. Warm the patient, warm the blood, and stop the bleeding. Thank you for your commitment to excellency in women healthcare. Together we are shaping safe care, improving outcome, and supporting every woman at every step.